uncovering autoimmune diseases using the lens of the eye. Hello, my name is Dr. Rudrani Banik, and I'm a double board-certified neuro-ophthalmologist and functional medicine practitioner. Today, we're going to explore a fascinating topic, autoimmune conditions that can be uncovered through eye examinations. Our eyes not only provide us with vision, but also offer valuable clues about our overall health. Here's an eye-opening fact. Did you know that over 200 medical conditions can be diagnosed from an eye exam? Yes, both common conditions can be discovered via a dilated eye exam, such as hypertension, diabetes, and hyperlipidemia, but also some less common conditions, including systemic autoimmune diseases. Let's dive into this intriguing subject of autoimmune diseases manifesting in the eye. Autoimmune conditions occur when the body's immune system mistakenly attacks its own tissues. Surprisingly, some of these conditions manifest in the eyes, making eye exams not just crucial for vision health, but also for diagnosing systemic diseases. Today, I'll highlight 3 autoimmune conditions that are often initially diagnosed based on certain eye symptoms and signs that are harbingers of systemic disease. First, let's discuss autoimmune thyroid conditions such as Hashimoto's or Graves' disease, which can be associated with an ophthalmic condition known as thyroid eye disease or TED. Patients with thyroid eye disease may experience symptoms such as bulging eyes, double vision, eye pain, dryness, redness, changes in eyelid position, and even loss of vision. During an eye exam, signs of thyroid eye disease can include eyelid retraction, swelling of the eyelids or conjunctiva, protrusion of the eyes known as proptosis, limited eye movement, or misaligned eyes known as strabismus. To confirm the diagnosis of autoimmune thyroid disease, it is important to assess thyroid function via laboratory tests, including thyroid-stimulating hormone or TSH, free thyroxine T4, and of course the autoimmune thyroid markers such as anti-thyroid peroxidase antibody or TPO, anti-thyroglobulin antibody or anti-TG, and thyroid-stimulating immunoglobulin, or TSI. Thyroid studies, such as an ultrasound, may be necessary. If eye symptoms are present, a CAT scan or MRI of the eye sockets or orbits may be necessary as well. Additionally, functional medicine testing, such as assessing gut health through stool analysis or evaluating food sensitivities, such as gluten or dairy sensitivity, may provide insights into underlying triggers contributing to autoimmune thyroid conditions. Secondly, let's explore multiple sclerosis or MS, another autoimmune condition with ocular manifestations. Optic neuritis, a common presentation in MS, may cause sudden vision loss, eye pain exacerbated by eye movement, and changes in color vision. Internuclear ophthalmoplegia, also known as INO, which is characterized by impaired horizontal eye movement and double vision, can also occur in MS. During an eye exam, signs of optic neuritis may include decreased color vision, loss of central acuity, or peripheral vision defects noted on visual field testing, along with a relative afferent pupillary defect, commonly known as a Marcus gun pupil. To confirm the diagnosis of MS, MRI imaging of the brain and spinal cord with contrast is essential, along with laboratory testing. Occasionally, cerebrospinal fluid or CSF analysis may be indicated to detect oligoclonal bands. Functional medicine testing, such as assessing inflammatory markers or evaluating vitamin D levels, may provide insights into the underlying inflammatory processes associated with MS. Lastly, systemic lupus erythematosus, also known as lupus, is an autoimmune condition that can affect various structures in the eye. Patients with lupus may present with symptoms such as dry eyes, eye pain, light sensitivity, blurred vision, or even vision loss. Ocular manifestations of lupus can include dry eye syndrome, retinal vasculitis, scleritis, or uveitis. During an eye exam, signs of lupus-related eye conditions may include conjunctival injection, corneal ulcers, or retinal hemorrhages. To confirm the diagnosis of lupus, serological tests including anti-nuclear antibodies, also known as ANA, anti-double-stranded DNA antibodies, and anti-Smith antibodies are typically conducted. If dry eye is a concern as well, then testing for Sjögren syndrome, with anti-SSA or SSB antibodies is important. If there is evidence of retinal vascular occlusion, then it is also important to check for antiphospholipid antibody syndrome, which can often be associated with lupus and cause blood clots, either in arteries or veins in the eye as well as in other parts of the body. Additionally, functional medicine testing, such as assessing gut permeability or identifying specific food sensitivities, may uncover triggers exacerbating autoimmune responses in lupus patients. When evaluating patients with suspected autoimmune conditions based on eye exam findings, it's crucial to perform a comprehensive systemic functional medicine assessment. This includes specific laboratory tests tailored to each condition, along with functional medicine testing to uncover the potential triggers and underlying inflammatory processes, and also help guide management. In summary, our eyes offer valuable insights into our overall health. They can be the proverbial canary in the coal mine, particularly when it comes to autoimmune conditions. By recognizing key ocular manifestations during eye exams and conducting thorough diagnostic evaluations, we can not only preserve vision, but also detect systemic diseases early, thus improving patient outcomes. I'm Dr. Rudrani Banik, and I want to thank you for joining me today. If you found this information valuable, please like, subscribe, and share this video. Your support helps us bring more educational content. Until next time, take care.
Hey, thanks for watching our video. If you order lab tests for your medical practice, head over to Rebelt.com to order hundreds of different labs from over 35 different lab companies, including Dutch, Dr. Zeta, Mosaic, and more.